Good morning, everybody. How are you? Just gonna move my little things around. I see all your chat. I'm so excited to have you all here. It's gonna be a fun morning. We're gonna go over some basics. Let me just grab my microphone so I can make sure you hear me. Welcome. So you are in the right place, and you're gonna start the stream from here. So I think probably, can you give me a thumbs up or a hello if you are seeing my screen, or you're seeing me at least, not my screen yet. No sound. Jen, are you hearing sound? Be sure to click on the video. Oh, you're giving them. Okay, great. Annette is hearing me. All right. This is a new platform. We had a little Zoom issue, so we've had to switch platforms. So thanks for being patient as we're learning and as we're starting to use this and go live in more places. So it's a little bit of an experiment this morning. But usually for our study groups, we're on Zoom, so that will be familiar. But when we kind of open these up to the community, we use this platform now. So anyway, so thanks for being here and for experimenting with us. So anyways, I love all the chitty chat that I saw. I see that we have a whole big group here, and I know that some of you are here at my request to to actually share your expertise. So I'm going to post a link for those of you who later want to come on the screen and with audio or with just your video, it doesn't matter. And you can share with us, your experiences. So I wanted to invite those of you who have taken the test or taken the course, whether you took the exam or not, to share that. So let's dive into the content. So what I promised I would do today is to go through the what, the why, and the how of getting ready to take the NCC certification exam. And so I'm going to just run through these slides really quick, and then we'll have a little time for some conversation as well. So, alrighty. So, as you know, if you haven't met me before, my name is Kathy Randall, and I am a neonatal nurse practitioner by training. But my favorite thing to do these days is to provide online education around anything NeuroNICU. And so we have several different courses, which I'll talk about and which many of you have participated in. But for those of you who are new, I wanted to just give you a little background about who is Synapse, who am I, and really what do we stand for and what do we hope to achieve. So with Synapse Care, this is a company that we created back in 2016, and it was really all focused on the idea that you as one person, as one nurse, one therapist, one physician, that you could make a difference. And that when we think about our units where we practice, oftentimes what I found then and still now is that sometimes you are the only one who cares about neurodevelopmental care, family-centered care, developmental care, and you oftentimes feel alone. And so the idea of Synapse Care and the One Conference was to bring all of you ones together, and so that you would feel like you were part of a community, and you would know that you weren't the crazy one, that you weren't the only one who cared about these things and these concepts, and were trying to help move your colleagues and your unit forward. Sometimes you were a little army. We've met lots of you, your groups, but we knew that you were oftentimes alone. And so the idea of being the one meant I can't do everything, but I can do something, and that we would inspire and educate and connect together in order for us to move our own practice forward and to be an example for others. So Synapse Care is all about being the one, and we do offer education, which I'll talk about, which is why we're here today. But we also connect, which you can see we're a community here, and it's not just about the content. Although when we're studying for an exam, it's a lot about the content, but it's not only about the content. And so it's really important that we focus on that, but also that you connect with each other and that you get inspiration, which is why I said I invited people who have taken the exam before to come to this, because I want you to be inspired that they survived and that they did it, right? So I don't want you to think, oh, so and so did it, but I can't, because that's not true. And you can definitely do this as well. And I'm going to give you lots of examples of that. So, like I said, at Synapse, we have 4 core courses. Like I said, many of you here have taken all of them. We have our small baby course, we have our brain cooling course, we have our AEEG and now expanded to NEARS course. And then, of course, we have our NCC NeuroNICU study exam course. So normally it's a self-study, but between now and April, we're going to actually do a live study session so that each week you can come and you can learn and you can get prepared for the test. So as I said, we're going to talk today about the what, the why, and the how of getting ready to take the NCC exam. And so let's just dive into then the what. What is the NCC certification exam, and why would you even be interested in taking it? So first off is what. It is an exam given by NCC, the National Certification Corporation. So it is not given by Synapse. We just help you get ready for the course. And the exam, I should say, get ready for the exam. The exam is broken down into 5 sections. And so when we run through these sections, we can feel confident that we are prepared for the exam. And so we know that 20%, 21% is all about neural development, and the thinking about the fetus and the newborn. So, what is that brain development, right? The stages, and we spend a whole lecture together talking about that. Then we have neuromonitoring, imaging, and diagnostics. That's about 19%. Then the bulk of the exam really sits right here between 28% and 23%, which is managing the neurologically compromised and at-risk newborn. So it's really, how do we assess and manage that baby? So whether that's cooling, whether that's seizures, whether that's hydrocephalus, what do we do? And so that piece is really heavy. And that's why in the course, we go through all the diagnoses together. Then we have assess and manage neurodevelopmental, psychosocial, and follow-up. So just kind of like what, beyond just the disease. And then 5%, like always, is about professional issues, ethics, end of life, evidence-based practice, and those kinds of typical things we would see on an NCC exam. So at least going into the exam, what is going to be covered. And they have a really great study guide, which we'll talk about a little bit later. This is just a picture out of their study guide, just kind of, again, same idea. All right. So when you go to take the exam, I wanted to share these 4 kind of tips, I guess, because a lot of people get freaked out about what is going to be actually on the exam. Well, number 1, the thing to know is that all the questions are multiple choice. And number 2, there are only 3 answers per question. And I'll show you some example questions at the end. So it's not going to be like this laundry list of 7 possible things. It is literally 1 correct answer and 2 distractors. So they are a little bit right, but they are not correct. So just to let you know, it's a multiple choice, and it literally has 2 wrong answers and 1 right answer. And there are no except questions. So there's not going to be which of the following except, right? It's going to be straightforward. And I'll show you some examples later. And it's also that they line them up alphabetically. The answers are alphabetically, not grammatically, not to throw you off. Literally, the answers are alphabetical, and that is how they're lined up. So never think on the exam like, oh, I answered C already, and now it's C again, and now it's C again, and it's C again. Nope, it's okay. It's alphabetical, and they're also randomly served to you. So you just don't worry about that. Okay, so that's the what is the exam. Again, it's administered by NCC, but what about the why? The why is important because I think one thing we forget about sometimes is that most of us have probably earned a certification of some sort, being in the NICU for as long as many of you have, right? And it's interesting to me to know from this survey that only 40% of American nurses are certified. And many of you carry multiple certifications, right? And I'd love for you to put in the chat, of these 5 or 6 I've listed here, um, how many of these do you have? As NICU nurses, I think we love to collect certifications. So whether you start out as a new grad getting stable and NRP and of course CPR, right? Those are all certifications. And I'm thinking that in that survey, they're talking about specialty certifications. So things like what NCC or ANCC offers on high risk newborn, or the RNC NIC exam. Most of us start there. And then we have things like trauma informed and touch and massage, infant driven feeding. I mean, there's all these new ones popping up all the time. And that's what the NeuroNICU exam is. It's new. It's only been around a few years now. So when you take it, you're going to still be part of the kind of first elite group who take this exam. So there is also a small baby or ELBW exam, and some of you have taken both, and some of you have, I know, all of these that I have listed on this screen. So there are many, many options for us as NICU nurses. What's great about the NeuroNICU exam is that there is no time minimum or minimum amount of experience that you need to take the NCC NeuroNIC exam. The NeuroNIC exam is also open to physicians, nurses, respiratory therapists, OTs, and PTs. And this is something that our group actually worked towards, to be able to have therapists be able to take this exam. And we've had several OTs and PTs take our class. We've had several respiratory therapists take our class, physicians, and of course, nurses, nurse practitioners, educators, and CNSs. So it's really fun to see so many people take the exam. I'm just going to put in, I just want to see your chat of, if you're saying that you have all of these. Yep, I see it. Massage, CCRN, NRP, stable, stable instructors. Jackie, you did CCRN and Nick and ELBW and TIP. Yeah, you guys love to have certifications, and me too. I do too. I love it. I love it. I love it. Okay, awesome. All right, so next up, I want to just talk about, oops, I need my little pointer there, is why to get certified. So yes, we know that there are so many options, but why? And really, studies show that people who have a specialty or subspecialty certification actually have better prospects professionally, whether that's in your own hospital or if you move from hospital to hospital. And really, it demonstrates a higher level of clinical competence. And then that can, in some situations, translate to higher salaries, more pay, as well, because there may be some sort of clinical ladder, or there may be some sort of bonus that you can get if you're certified. It's not true everywhere, but it is something that is out there. You can position yourself for more respect and recognition. Use those initials proudly. Wear those pins on your badge and on your lanyards. You've earned them, and so definitely, wear them proudly. You can be more marketable. About 90% of nurse managers say that they would hire a certified person over a non-certified person. So again, not saying that you're moving jobs, but maybe you're moving even vertically in your own organization. It shows commitment to excellence. It demonstrates that you're dedicated to a certain area, that you took the time to become more of an expert in even a smaller area of nursing or in medical care. So you may make more money, like I said, according to salary surveys. And again, I think number kind of 8 here, which is it gives you that sense of pride and accomplishment, even if your job doesn't pay you for it, or doesn't pay for you to take the exam, or even pay for you to take the study course that we offer. It's still for you that sense of accomplishment. And it's just like finishing anything. When you get certified, it's, you just have finished something and you have accomplished something. So I think that's, to me, the most important one. All right. So what about the how? Well, when you go to take an exam, there are lots of ways to get ready for that. And so you can just read books, you can, like watch YouTubes. I mean, there are lots of ways to get ready to take an exam. So for the NeuroNICU exam, there are some very specific books that I would recommend. And these are the books that we use in our study course that walks you week by week through what to study. So we take all of those core components and core competencies of the exam. We break it down, and then we also tell you which books to study and which chapters in the books to study. So here on this slide are the three most my favorite and kind of the kind of core, I would say, of neonatal neurology. So it's Volpe's book, Neurology of the Newborn. It's Stevenson's book, Fetal and Neonatal Brain Injury. And for me, this one is not specifically brain, but it is definitely for me an easy one to study and to carry around. So these are my favorite top three. And then there are a few others that I think add in for some other types of studying. The Golden Hours book, which is great for both the small baby and the NeuroNICU exam. Fetal and Neonatal Secrets, which is, again, good for any of the exams, starting from your basic RNC NIC exam all the way up through NeuroNICU. And then I don't know if you've seen them on Amazon, but there's actually by JC Wood these new study guides. And so we'll be using these in the course together. And we'll be going through some of the questions in there, just so that you know it's 200 study questions. And this is amazing. And again, it's available on Amazon. If you haven't picked it up and you're looking for a nice just way to just self-study and carry it, it's really thin and you can take it in your bag around. Anyways, it's something new that we didn't have even the last time we did the study group. So I'm super excited about that as well. So those are my favorite books that I would recommend. And again, this is a perfectly acceptable way and probably how most of us have passed our other exams, right? We just have our book, we study. But I think that there is a better way, and that is to actually join our study class or to join our study group. So we do have an on-demand version of the NCC NeuroNICU study class, and you get lifetime access to it. We have study guides, we have quizzes, and we have an app for your phone that you can watch the lectures on the go. And I know Anne, who's on the call, she does that a lot. She listens to them as she drives. So I think the course is an even better way to study, that it supplements the books. And what we did is we've taken all of the sections of the course or of the exam and broken it down into 6 different areas. And then we tell you which chapters to study for that one. And then we have a conversation about it on our Friday calls. So I think you can either go by yourself, self-study your way through it. Maybe some of you have the exam sooner than when we'll finish in April, but you can definitely, study on your own as well. And this, of course, this step-by-step is, if you want to take 6 weeks, you want to take 6 months, you want to take 6 years, you can, follow this little step-by-step navigation through all of the important parts that you need to study. So when you log in there, we have a class dashboard, all the lectures, all the resources, everything is there for you. Some of the favorite things that people have mentioned before are actually these YouTube videos that I've curated. I've scoured the internet. One of my favorite things to do is to go on YouTube, and I've pulled out really short little study videos from medical school and from nursing schools, and they help to solidify the knowledge that we already have that we're just reviewing, right? And that's the thing I want you to remember is you have this knowledge and you may just have forgotten that you had this knowledge. And so what I do is just kind of give you these cute videos. So if you're in a time crunch, you can just watch these 3 to 5 minute videos as you go. So the course dashboard is filled with things. Like I said, the quizzes, the actual 1-hour lectures from the original course that we did. I think they're mostly, there are 2 to 3 lectures per section. And then we have some bonus things that we've pulled in from one conferences and from other webinars that I think you'll really enjoy. So everything is to complement that particular module. All right. And then let's see. Of course, I said we have an app, makes it easy on the go for you to access the course. And so all you do is just enroll in the course, and we send you a login. You go from your phone, and you'll get there. It's actually new. Some of you have used our old standalone app. This is actually integrated now together with our actual website, and so it'll remember where you were from one to the other. So that's kind of nice now. Oops. All right. So, like I said earlier, just to give you a little bit more of kind of some tips and information about the exam itself. So I said all questions are multiple choice, only 3 options per question, 1 right answer, 2 distractors, and no accept questions. And so here's an example. And remember, all answers are alphabetized. So you don't have to worry that there's some sort of trick, right? So, like on a rainy day, the sky is A, blue, B, gray, C, white. So do you see how they're alphabetical? B, G, and W. So on a rainy day, the sky is, and so you can choose the right answer. So I thought we would do a couple sample questions that I pulled out from the NCC study guide that you can get online. And so let's answer these together. Anne's saying she used the guide. Thanks for sharing that. The new study guide, right? You're meaning, Anne. All right, so let's do this little quiz together here. Let me make the slide big for you. Okay, sample question number 1. A very low birth weight infant is at risk for germinal matrix hemorrhage due to A, B, or C. A, decreased cerebral blood flow, B, fragility of the germinal matrix, and C, increased blood-brain barrier. And I am seeing B coming up as the answer. Most of you putting in the actual, and that is correct. Excellent, excellent. All right, next sample question. What is the preferred imaging technique for the routine follow-up of ventriculomegaly? A, computerized, we'll just say CT, B, MRI, C, ultrasound. What would be the preferred imaging technique for routine follow-up? Let's see. I think most of you are saying C. That is correct. C. Now, most of us would want babies to at least get several serial MRIs, right? But the most common routine is ultrasound. And the thing to remember is it's not what do we hope the ideal state is, but what do you think happens the most? And this is, again, we wrote this test back in, I didn't actually write it. I recused myself from writing it, but we met to talk about the exam. Gosh, it's been at least 5 years, right? So think about kind of where we've come in practice in even that short amount of time. So 3 to 5 years ago, what was probably the most routine? Ultrasound. So not that MR is not the right choice, right? We would all want our babies to be getting more MRIs. All right, number 3, a term neonate, that's a typo there, a term neonate with HIE develops seizures at 24 hours of life. What is the first line agent for treatment? And this is, again, what is the most common? Diazepam, phenobarb, phenytoin. Let's see what you all say. Wait for a second for that to come. I am seeing lots of phenobarbs. Exactly. All right. So those are some of the study questions. You can do ones like this, or these are in the NCC study guide. So those are available online where you apply to take the exam. But also you can use the book, like I mentioned, JC Wood's book, and that would be another great tool to use to study. So you can read on your own. You can take our self-study course. You can do practice quizzes, or you can do all of that and get the support of a community by coming to our live calls. And so that's included for free. You can get this study group and the self-study, and you can have these classes for free. So we are going to have today, which is the kind of the course overview. And then the rest of February, we have 2 more, the 17th and the 24th. And then we have 4 sessions in March. So the 10th, the 17th, 24th, 31st, they're always on Fridays. They're always at this time, 8 a.m. Pacific. And we go step by step through the 6 pillars of the course to get you ready for the exam. So you will literally be ready to take the exam by April 1st. So what have previous students said? And I'm so excited that we actually have past students here so they can actually tell you themselves. And so let me put the link for those of you who want to come on screen or on audio. You can join using that link. But here's some of the things that people have said who've taken the course before. I'm extremely happy and grateful for you helping me to prepare and successfully pass the NCC exam, the NeuroNICU exam. Thanks for paving a path so that people can study and understand the complicated brain in a simple manner. That is always my goal, to make it simple and doable. That is one of my favoriteest things. It's been a long time since I've had to study. I actually had no idea how to study anymore, especially since there were not any practice tests at that time. So the course was wonderful, helped prepare my thoughts. I would listen to the classes on my commute. Even if I'd never taken the exam, everything I learned made me a better nurse and a more compassionate person. I don't think I would have ever had the chance to pass without the course. So again, it's so fun to get these emails from you all when you send them to us. Thanks for such an amazing review. I received my exam results and I passed on my first try and I scored strong in every section. I solely relied on this course, but the course was the most helpful. The course was an excellent review of NeuroNICU. It helped me expand my knowledge. I took the NNIC a couple weeks back after reviewing the content, and I scored very strong in all sections. Super review, Kathy. So anyways, I love it when you guys send me these because I love hearing from all of you. So if you are not already registered, and I know some of you are, we wanted to make sure that you kind of knew where we were headed and what the dates were and that you were all primed and ready to go. If you haven't enrolled in the study group and the study course before, it's $149. You can scan this QR on your screen or just go to ncc.synapsecare.com and you'll get the study groups for free. We're not charging anything extra for those at all. We record all of them so you can go back and watch them in case you can't attend live and all of that. So let's see if anybody was brave enough. Christine, do you want to turn on your camera or you're just going to do audio? I can unmute you. There you go. Oh, there you are. Okay.
Hi.
Hi.
Hello.
Do you have any questions or have you taken the test before?
Oh yeah, I took the test. I took your course and I took the test last year and passed.
Excellent.
And I'm a PT, so I was super grateful to be included.
Oh, well, thanks for hopping on too. What would you say to someone who's feeling nervous about doing this?
That I think that this course really prepares you. Your lectures and all of the lectures are amazing. The videos, like you said, and I would say if you're not a nurse, if you can ask one of the nurses for the neonatal intensive care core curriculum, one of the nurses gave me that. That was super helpful for any non-nursing people, but just study, lots of reading, lots of research, and the videos, everything helps. So yeah, so you can do it. You can totally do it.
Oh my gosh. Remind everybody what your discipline is and your role in the NICU.
I'm a physical therapist.
Physical therapist.
So yeah.
So there you go. And I'm right.
So
awesome. Well, thanks, Christine, for hopping on. I hope you'll come to some of the study sessions just to keep learning and hang with us when you can. But thank you so much.
Absolutely. Thank you.
You're welcome. Hey, Lisa.
Hi.
Did you have a question or you just wanted to come and ask?
I was just going to say that I took your course also and passed. The structure that you give, all the way that you kind of organize the handouts, for people who are, I forget what the word is when you're an old learner, but you're kind of you're not like a high school student going into university. you need that kind of assist with structure. So there was that piece, and also the quality of the information you gave. You bring together people from, all over the country, really large centers, nurses who are really immersed in the field. So I really felt like I was getting really applicable information. And also then it allowed me to be not only pass the exam, which was good, but and that was kind of my goal. But like other people have brought up, being better at the bedside, being better able to advocate for my patients, teach and mentor other staff, all of those pieces it was really, really powerful for me. So I just
Oh,
wanted to comment.
that's awesome. That's
I
awesome.
think I mirror things that everybody else has said. I don't think there's anything new in what I just said, but just that was also very, very powerful for me.
No, thanks for that. No, I think it's helpful. I mean, it's easy for me to like read off a slide, like these are things that people said, but I think hearing it in your own words is helpful for people. And I agree with you. Yeah, whether you take the exam, which is kind of the icing on the cake. Yeah, the course is all those modules, like you said, we do have different speakers. I just help to moderate mostly. I don't really even give most of the lectures. So I think I maybe give one or two maybe, but overall we did it as a co-op where people came and taught in exchange for coming to the class. So that was really fun. And so we were able to get lots of other expertise.
Definitely. Well, thanks.
Jackie, thanks. So Jackie, you're asking how many CEUs. So currently this course, to keep it at that affordable price of $149, we do not offer CEs for it. It is something people have asked. And so I think it is totally eligible. It's just one of those where when we first built it, we wanted to just, get it out as quick as possible and at a low price point. So that's why it is the price that it is. It would totally be possible to do an add-on for people if that was something that people wanted. But currently we don't offer CEs for it. Is there any other questions that I missed? If I missed your question, just type it again. Anybody else? Oh, Anne. Hey, Anne. You don't have to come on video, but you can.
That's good. I'm out walking in the rain, so I'm covered in rain garb anyway.
No worries.
So this did absolutely help me pass that exam on the first try. But truly the best part about this course is once that exam was done, had I done it the traditional way of just picking up Volpe and studying, honestly, I probably never would have picked up that book ever again. Mm-hmm. I mean, I'm just not going to be one to like review my notes just for the fun of it. It was the fact that I could get online, I could listen to the lecture. As I said, I drive to work and I'm listening to something, I'm reviewing something. Your YouTube videos that you found were just so wonderful. And that I keep using this course at least once or twice a month as I'm rotating through different lectures from your different classes. So like, I really got my money's worth out of this. This was not just something that I used to pass the test.
Oh, that's great.
To listen to basically, a lot of the lectures were run by bedside nurses like me. They, they weren't necessarily the experts in their fields. They were nobody I needed to be like in awe of. I was just like, that's a guts to get up there and present a lecture. And, it was led by nurses and it was just wonderful to hear. And it didn't get too technical, that you felt that it was above your head and that you felt like you understood absolutely everything that was going on. So thank you for that.
Yeah, you're welcome. Someone asked thank you, Anne. Someone asked for the dates. Here you go. These are the live dates. I'm at the Newborn Brain Society meeting next week, which is why we're not meeting next week. So we're going to start on the 17th. And then the 24th, and then we have a week off on the 3rd. I'm at the California CAN meeting down in San Diego. So if you guys are there, love to see you. And then we'll pretty much meet every Friday for the rest of March. So there's a couple little gaps in there, mostly just for travel and conferences. And I added back in the 10th because I'm not going to be at Graven. So I'm sorry for those of you who will be at Graven that day. I'm not sure if it's in the middle of a session, but I was going to speak at that time. So that's why it's not happening, or originally wasn't happening. Awesome. I'm just looking at some of the chats. Yeah, Christine said she definitely goes back and reviews. Sorry, Christine. I just saw that. Yeah, definitely. All right. Are there any other questions? I'll put the slide up in case you are still wanting to get registered. There's the QR code. All of you who have previously taken the course, you all know you are welcome back as always. Oh, there's Kim. Let's hear from Kim.
Oh, hey. Good to
Hi.
see you. Welcome, everybody. Yeah, like everyone says, the course is just excellent and a great way to, something's happened with my screen here. Oh, there it is. A great review. There's so many options no matter what kind of learner you are. And I highly recommend you figure out the best way that you personally learn. For me, I'm a very visual learner. And so as I was studying, I drew a lot and made charts. And as I took the test, not only did I hear Kathy's voice multiple times go over in my head, and I'd be like, well, that's the answer. I heard Kathy tell me. And then I would visualize these graphs that I would print out and draw. And so really hone in on your individual style of learning. And I think you will be very, very successful in this program because all the information's there. I was not surprised on any single question. It was all information I already knew.
Oh, that's so good. Yeah. And Kim found this really great cranial nerve picture, right?
Yes, with the man's
With the
face.
face or something,
Yes,
right?
right.
Yeah,
It's
I'm pretty
YouTube.
sure we posted that one after you shared that because that
Yeah,
was so amazing. And actually, I
yeah,
was just looking through some test questions yesterday, and the cranial nerves that were coming up, and I was like, oh, I need to like write that out again because I had
yeah.
forgotten the numbers.
Yes, and I quickly drew that out on my scratch paper at the testing center and referred to it multiple times during the test. So
Yeah,
good to know.
yeah, I think that's the one that throws people the most. Is that one?
Yeah.
The cranial nerves. Well,
Great.
thanks. And I think you're going to
Yeah,
be at Newborn Brain Society, right?
I am. I am. I'll arrive on Wednesday in time for some pre-conference work.
Awesome. Yeah. And I think Anne's going to be there. I'm not sure who else is going to be at the Newborn Brain Society. Amy, you were asking these sessions are for those in the class. Correct. So we did this call today free for everybody in our community just to remind you that the NCC exam is out there. The NeuroNICU exam is there, kind of what to expect for it. And then those of you who are, wanting to take the study course and be ready to take the test by April, then that is what those extra class days are for. So let me go back and find those dates in case you need those. And again, we do record all of them, so not to worry at all if you, if you need to miss a couple, they're there. I mean, the course on its own stands alone, whether you come to the live classes or not. So not to worry at all. But yes, so these are going to be closed Zoom rooms and we'll meet together as a small group to go through these. So I'm hoping that was your question, Amy. If not, go ahead and answer it again. Or you can come online if you want. Anybody else want the link to come and share or ask any questions? I'll put the link back in the feed for any of you. But otherwise, Kim, anything else you would want to share? Let's see. Oops. There you go.
Oh, there I am. Yeah. Gosh, no. The course is just really great. Put in the work. Concentrate on just setting a timeline for yourself, really, and
Great tip.
just stick to it, and you'll be very successful. I'm 100% confident. Yeah. Good luck. Have
Yeah.
fun.
Thanks, Kim. Thanks. Yeah, Jackie, your comment is really is well taken. The importance of the community. Yeah. And I think that was really and I just took Kim off the screen, but it was really fun because she was taking her exam, I think like the last week. I think we had to move a couple dates. And so she took her exam even before we finished. And it was so fun for us to know that she was doing that. I think she even hopped on her way to class. I don't know if that's right, but I kind of remember that. And it was just really nice to be able to know that you all were taking the test, that we could support each other and cheer each other on. So definitely agree, Jackie, with that for sure, that the community definitely supports. And the work we do in the NICU, it's just the beginning, right? It's it was really one of those, it's just the beginning, and you take that information and you now have a network of individuals for that. So let's see, somebody is asking for the registration code. There you go. There is let's see if I go this way. There you go. There is the code. Or the website is just ncc.synapsecare.com. Maybe Jen, would you put that in the chat if you can? Awesome. Well, that was all I wanted to go over today. I also, for those of you who are already enrolled, I wanted to make sure that you didn't forget that we were starting, because some of you purchased the NCC course as part of the bundle at the end of last year. And so it's been a while. And so although it doesn't seem like it should be that long ago, but it was the end of last year. And so I wanted to remind you that we were going to do this live cohort, that these were the dates. And then also just let you know that if you felt behind, that you are not behind, that the dates are coming up. The 17th will be week 1. So you have these first 2 weeks to dive into the course. You have between now and the 17th it's really 2 weeks to get in there, get organized, print out the step-by-step study guides, order some books. I know some of you are interested in even renting books from past students. And so I might just even send an email out to all of you who've taken the course. If you'd like to rent your book to someone, I had somebody ask if that was possible. You can rent books on Amazon as well. And even some of you may have bought all the books and you want to sell your books. And I'm sure there are students who would buy them from you. So definitely let us know via email if that's something that you're interested in. We might be able to help connect you with that. But, I think for me, the book I love are those ones that I can use every day in my practice. So the Lang book, and there's even just the Stark book. Some of these are books that you can use every day. Awesome. Just saying. Oh yeah, great point. Judy just said, some of the books are ebooks, and that is absolutely true. I have the Volpe book as a Kindle. So I have the old paper version, like the 5th edition, and now they're on the 8th edition, and I have upgraded on the e-Kindle. So that is definitely true. Kimberly's encouraging, just do it. It's really fun to study with others. Totally believe in that too. Let's see. So Amy was asking, am I understanding correctly? The new class is starting soon. Yep. So the first live session is going to be on February 17. So not to worry, it's 2 weeks from now, and then it'll be almost all the Fridays. I can bring let me bring up the page again that has the dates. You can take a screenshot of that. Let me move my little picture out of the way for you. So the new class is starting. So today is just kind of a kickoff call, like we're ready to start in case anybody was kind of on the fence about whether or not they wanted to come, or what is the deal with the self-study or the study groups. So this is the sessions. The course itself is on demand. If you buy it today, you could actually do the whole thing on your own and never even come to one live class. You will be fully prepared even if you do it that way. So if you need to decide to you can register all the way. You can register anytime. You can register in March. You can register in April, and you can watch all these recordings. We put them in the course. If you want to be in person and live, then just as soon as you can, make that decision. And yep, Annette saying she works on the 17th, but can she watch the recording? Absolutely. We put all the recordings for the study sessions in your course portal. So anytime you can come live, and otherwise we're there. Yep. And Tony, same. If you miss a Friday, is there a recording? Absolutely. There is a recording. Yeah, Kimberly, you felt nervous, but you were very prepared. But yeah, definitely, we are going to be putting the recordings up for you, so not to worry. And they're all in Zoom, like I said, so we're all together on screen. We don't swap back and forth like this. And this is just so we could broadcast. And Jackie said, "We'll be there holding your hand." Absolutely, absolutely. So let me put back up for those of you who are wanting to take a screenshot of where you order, and we'll send you a reminder, that we're going to get started, so don't worry. We always email and try to make sure everybody remembers that we're getting started. So anyways, well, I just want to say thanks everybody for coming, and thanks to our past students for hopping on. It's always fun to see your faces. I've missed seeing so many of you. Excited to see many of you in person at some of these upcoming conferences. And we really are a community, and this is a great course to take with us at Synapse, because I think it's the core of who we are. It's community, it is educational, but it is also inspirational in that you can do it because you have the support of the community and the evidence that other people before you have done it. So it's a hard exam, right? It's a brain exam, but you can do it. You can be prepared with all the tools that we give you. So anyways, thanks so much for that. Oh, Jackie's asking, where are we going to meet? Oh my gosh, we'll be able to find each other at Newborn Brain, and we'll definitely bring back a synopsis. That's a great idea, Jackie. There's going to be a lot going on. So we'll make a note of that to maybe do a little live where we can come together on Zoom and chat about what we all learned and what we took away from there. Because I know we've got Diane's going to be there, Kim's going to be there, Anne's going to be there, Bobby Pineda is going to be there, Terry Ender is going to be there, and so many more. So, and just message me when you get in. We're going in early to visit some family. So Jane will be there, Jane Solomon, the whole St. Joe's team will be there. So yeah, it'll be fun. So, all right, everybody. Well, that's it for today. We'll see you hopefully in person or all online soon. I know Jackie will miss you. She's saying all the people. Yeah. Yes. I know we miss you. Well, it's not too late. You can attend virtual too, if you want. So excited to see you all. If you want to get registered, ncc.synapsecare, and we'll see you online soon for some event or for the course. Bye, everybody.